clinicians document in the electronic medical record, which is Epic. Any field that they're documenting in, we've had our hand in testing it, customizing it.
Whatever you're trying to go in and chart on a patient, we build that. So if there's a need, you just let us know and we figure out a way to get it in Epic for you.
So it was good that I was a medical technologist prior to coming here because I knew what the lab was talking about when they were asking for requests, where somebody that didn't have a clinical background, they wouldn't even know where to start with some things.
It's a plus to have a background in the medical field because you understand the workflow. You understand how you would chart and the flow throughout the day. The hardest part was to step away from, I am not treating this patient, I'm helping the nurse document, work through their workflow.
Although you lose the patient contact, you gain a different perspective. Knowing that they're taking care of their patient better because of what we do is as fulfilling as taking care of a patient directly. To me.
I think that mentally you kind of have to be ready to step away and want something different. Because I can relate this job back to our users and how they're helping patients, the transition was easy for me, I believe.
Transitioning from the lab to IT, I feel like was a career advancement.
Whether they're sending you to training or giving you tuition reimbursement, I've always grown here.
Allowance for learning all the time is always there.
You're able to learn more about the software that you're supporting. The more that you know, and the more you can actually help the people in operations.
One common misconception about your clinical informatics is that you have to be very tech savvy. And that's actually not so true. A big part of our job is project management. I think at any given time you're working on maybe 20 different things.
Your team here is your resource. Everybody has a different background, so everybody has strengths that they can bring to the table. So we really do work as a team.
There is times that we get together to do team building.
The holiday parties, every year we have a holiday party. Just let your hair down kind of thing.
The best day is basically coming in every day and then knowing that you have your coworkers there to kind of support you, so you know that you're not alone.
The good thing about IT is that what you work changes every day. So there's never a boring day. I feel like every day I get a new puzzle.
And I like that. I like the challenge of having to learn something new.
Don't think of it as being super technical. Just think it as being that person in between the technical and clinical worlds.
You still can be keeping up with things that are happening in the lab, education-wise, and then also learning new things every day in the IT world. So it's really a good balance between the two. You never really leave the lab, so.